Hello, welcome to ANA community. In this particular video, we are continuing with the points of a general examination. In this particular video, we are going to discuss the respiratory rate, its significance. So, respiratory rate is one of the vital signs of a general examination. So, in that, temperature, pulse, respiratory rate, and heart rate, etc., coming under the heading of vital signs, which are again part of the general examination. When we think about respiratory rate, this varies between 16 to 20 per minute. In some of the textbooks of physical examination, it is mentioned that 18 to 22 cycles per minute is being mentioned. In females, respiratory rate is higher, whereas in case of infants, the respiratory rate may be higher, but maybe more than 40 cycles per minute at the time of birth. This is in relation to the adaptation of the baby to the external world. Respiratory rate that is affected by exercise, emotion, or excitement. Affected in the sense that is going to get increased abnormally during the exercise, or when the person is in emotion, that is elated mode or anxious mode, or in case of fear or frightful situation, there will be respiratory rate will be increased. And even in case of excitement, that will be increased. As far as pathological increase of respiratory rate is concerned, it is increased in case of fever. In the person suffering from diseases of the lungs or diseases of the heart, and in case of pleural involvement, that is involvement of the pleura. Whereas the respiratory rate will be decreased in case of narcotic poisoning, specifically opioids. In case of endocrine diseases associated with hypometabolism, such as the person maybe that is hypothyroidism, uremia, the condition where blood urea is increased, diabetic coma, a complication of diabetes mellitus, where there will be ketoacidosis features will be observed there, and the conditions of raised intracranial pressure, such as the hemorrhage inside the brain or brain tumor, etc. Respiratory rate and pulse rate, they are having the relation, that is the respiratory rate and pulse rate, that ratio will be 1:4. That means for every increase of one respiratory cycle, there will be increase of 4 pulse rate that will be observed. Increase of 4 pulse that will be observed. In other words, if the respiratory rate is 18 per minute, the pulse rate will be 72 beats per minute. So, in total, the take-home message from today's discussion will be respiratory rate. It varies between 16 to 20 cycles per minute, or otherwise 18 to 22 cycles per minute. In case of females and in case of infants, respiratory rate will be increased normally. Respiratory rate that is going to get increased in case of exercise, emotional excitement, and it will be abnormally increased in case of fever or diseases of the lungs or heart, and in case of pleural involvement. Whereas the decreased respiratory rate that will be observed in case of narcotic poisoning, the hypothyroidism, uremia, diabetic coma, and conditions of raised intracranial pressure. Dear ANA community members, that's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one video that you would like to hear in this particular channel? Mention in the comment box below. And spread this particular video to maximum number of true Ayurveda learners so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.